I woke up one day and the two fingers were numb, and I thought it'd go away on its own in a couple days. And after about 2 weeks, it progressed worse into the other fingers. And then my thumb became useless. It had no strength or muscle at all. After that, I went to my chiropractors. We tried for about a month and a half. The first 2 weeks helped quite a bit, but then it was going back to worse. I came to Basic and saw Dr. Farahmand for pain management treatment.
James came in to see me chiefly because of a complaint of electrical, sort of burning type pain that he was experiencing in his left arm. Since he had already gone through some very conservative and appropriate treatment, my recommendation to James was to try a cervical epidural steroid injection to try and reduce the inflammation in his neck further.
I want to avoid surgery as much as possible. Who wants to have surgery done? We went for one spinal nerve block.
We take a needle and under x-ray guidance, guide it in between these bones and deposit the needle and the tip of the needle over the nerves where the bulge exists. And once the needle is in the right position, which we can see under x-ray, we inject a cocktail of medication to A, numb the nerve to try and get rid of some of the pain, and B, add a steroid to the nerve to try and reduce the swelling and the inflammation.
I got 50% relief from that. Called back, so about 2 to 3 weeks later, had a second one done. And it stayed the same.
Unfortunately though, with the second epidural, we didn't make any further progress than we had with the first. I thought it would be in James's best interest to have a surgical discussion with one of my colleagues to see if there was anything else they can offer him.
I thank Dr. Farahmand for what he's done. He's a great guy. He helped me out quite a bit. And then I had to get a consultation with a surgeon, Dr. Tai.
The model that we have here at Basic is that surgery is the absolute last option. So when James came to us, even though he had a pretty significant problem, we did have some options for him that didn't involve surgery. Initially, he saw Dr. Farahmand. Our goal was to help alleviate some of the pain, see if we could get him into a program that could recover the function in his hand, and if we did, we would be able to avert surgery. If we didn't, we had a plan for a minimally invasive outpatient procedure, but as I told James, that was our last option and that we wanted to try everything else possible before going to surgery.
He said he would do a surgical procedure called an ACDF, an anterior cervical discectomy fusion, taking the disc out, putting in a surgical implant and taking the place of the disc, and doing a bone graft so that the vertebrae would fuse together as one.
Traditionally what's done is surgeons will take out the disc, they'll put in some sort of graft, a large plate over the vertebra with screws that then fuse these two levels together. In order to do that, traditionally you would have to make a incision that's a couple inches long. The surgery itself could take upwards of 4 hours. Using some of the newer technologies for this type of procedure, we were able to make the incision about 1.5 centimeters long. The surgery itself took about 30 minutes, and we were able to successfully remove the disc and put in a very low-profile small implant that got James better. I'm
here 6 weeks out of surgery, no issues whatsoever. All the issues I had 5 things going on, from annoying to very painful. They are all gone. I can move my head from the right to the left, back, forward. The brace came off last week. I don't need it no more. I don't even have a scar to speak of on the front of the neck where the incision is made. I told Dr. Tai, it's no problem if I have a scar or not. So he's not going to get one from me. So good job done. I really firmly believe that here at Basic, they believe in moving lives forward. Well, they definitely have my life moving forward. I just want to say thank you to Basic.